There's something curious going on when treating patients with clear aligners. Aligners have a homogeneous thickness of 0.75 millimeters, and they cover the whole occlusal surface, from the frontal to the posterior teeth. As the aligners cover the whole occlusal surface but have a fixed 0.75 millimeters thickness, what happens is that a patient, while wearing an aligner, will experience a pre-contact on posterior teeth. So posterior teeth will simply touch first because they are closer to the rotation center of the mandible. And it is in fact this kind of pre-contact that produces that unpleasant thing called posterior open bite at the end of some Invisalign treatments. For that reason, you should always plan for strong interocclusal contacts on posterior teeth. This way, you will counterbalance the intrusion effect those teeth are subjected to. Et voila! Our first case showing us what happens if we don't think about the posterior pre-contacts in a patient that is wearing aligners. It was a fairly easy case. He just needed some alignment and to get the right spaces to place implants after orthodontic treatment. As you can see, the starting posterior contacts are just fine. Exception made for that premolar that is just a bit retained in the upper arch. After the alignment sequence, we finalize the occlusion and, after only 15 aligners, the case should be solved. But look at what happens to posterior teeth. Yes, this is what we get if we don't pay attention. As the patient has worn aligners for several months, the posterior teeth got an undesirable intrusion effect. That is for the reason we just talked about. Patients wearing aligners tend to get their posterior teeth intruded by the occlusal forces they develop on those teeth. In fact, as they are closer to the rotation center of the mandible, they simply touch first. And as posterior teeth with aligners touch their antagonists before the front teeth, they get intruded. So, at the end of the treatment, you get posterior teeth that are not touching themselves. Very annoying for the patient, and thus very annoying for us. Another thing that happens is that front teeth tend to have a pre-contact. So the patient will end up with premature occlusal contact on the front teeth and with no occlusal contact on the posterior teeth. Nasty. So, what can we do to avoid this groomy side effect with aligners? Well, that's fairly simple. The ClinCheck gives you the ability to check for occlusal contacts at the beginning and at the end of the planned treatment. Usually, a patient will show homogeneous interocclusal contacts on both upper and lower arches at beginning of treatment. Normal occlusal contacts are shown as green spots. You just need to plan for strong interocclusal contacts at the end of the treatment that are shown in red. In the ClinCheck, you need to plan for strong contacts on the posterior teeth in order to avoid posterior open bite. This means the posterior teeth will get some extra extrusion, which will counterbalance the intrusion effect of the aligners. But that won't be enough. you will need to plan for strong contacts on the posterior teeth and for no contacts on the front teeth. Planning for no contacts in the front teeth, which are all incisors and canines, prevent those unpleasant pre-contacts on the front teeth. So, get a better view of what you need to do here. On the left you see the starting occlusal contacts, which are shown in green. This means the upper and lower arch at the beginning of the treatment touch themselves in a maximum intercuspidation position, right on those spots. But what you need to see at the end of the ClinCheck, which is the supposed final occlusion of our patient, are red spots on the posterior teeth. These molars and premolars will get a programmed over-extrusion, great enough to make them counterbalance the intrusion they have experienced due to the mastication forces. This is the starting point and the ending point of the same case, in which you can see that also the upper molars and premolars have the same contacts planned. Here we didn't plan for strong contacts on the second and third molars because it was a fairly quick case. Remember, the longer the treatment will be, the stronger the posterior contacts will need to be. And as we said before, the other important thing is not to get any occlusal contact of the front teeth. So, on the left side, you can see the initial situation, and on the right side, the final planned situation. As you can see, we have created a positive overjet. This will make sure that only posterior teeth get in contact at the end of the treatment and that the patient's front teeth will barely touch, as it should be. If you are planning longer treatments, you can ask in the comments for even stronger interocclusal contacts. In this case, molar and premolars will get some more programmed extrusion, which will help you counterbalance the longer intrusive forces those teeth will face. And as always, you should plan not to have any occlusal contact in the front teeth. This means you will need some degree of overjet, usually around 1.5 mm, to make sure front teeth won't touch at the end of the treatment. To get the overjet you need, the ClinCheck will automatically propose you to procline upper teeth. The ClinCheck might also plan to retract lower teeth, and you may need some interproximal reduction to be able to retract them properly. This is especially true if you also have lower crowding you need to solve. And here is a great example of what you need not to do. Planning strong interocclusal contacts on the posterior teeth and leaving a strong interocclusal contact on an anterior teeth is an incredibly bad idea. This will most likely cause a strong frontal pre-contact, which will annoy the patient and maybe mobilize the tooth a bit. But most of all, you don't really want to be forced to take new impressions and to make a refinement just for this silly mistake. So make sure to have the occlusal contacts right where you need them to be at the end of the ClinCheck simulation. Now you know how important it is to plan for some overextrusion of the molars and premolars to counterbalance the intrusion forces those teeth experience due to the aligner thickness. Also remember to get no contacts on incisors and canines, as these will prevent anterior pre-contacts.